Hi, I'm Dr. Atencio. I am a board certified plastic surgeon with Westlake Dermatology at the downtown location.
And I'm Dr. Amy Sanders Mechanic, and I'm also a board certified plastic surgeon, mainly located at the Domain location in Austin, Texas. However, I get the opportunity to go to the Georgetown location as well as the Lamar location over by Kendra Scott in downtown Austin.
Amazing. We are so happy to see you guys here and to talk about liposuction. Obviously, it's a very, very common procedure that we both do. So we enjoy talking a little bit about it. In the process, if you have any questions, please feel free to send those to us, and we'll go over all of those questions at the end of the webinar.
Yeah, this is your time. Just feel free to put anything out there, okay?
And we wanted to do it more like a conversation rather than a whole lecture. So we will have a few photos to show you some things at the end that we prepared. But in the meantime, we're just trying to have a conversation about what liposuction is. And that's sort of where I'll start. I like to say the liposuction is like sculpting, right? That's why those two words are normally together. We remove the fat to give better shape, to reshape certain areas. What I don't think it should be considered is like a weight loss procedure. If you are considering liposuction as a weight loss procedure, you can see that maybe in the future you will maintain your results long term. So it's nice to be at a healthy lifestyle, healthy BMI in order to get the most out of the procedure. Um, what do you think?
Yes, I agree. I think that traditionally liposuction was definitely established to fine-tune patients, and it has developed over the years to address patients who are not necessarily really small, who have just a little tiny bit of something to deal with. So I think it's kind of evolved to help patients be able to not lose weight, just like you said.
Yeah.
However, maybe be able to decrease that thickness, be able to start themselves on a regimen where they can start to make some changes because they feel better
Absolutely.
about themselves.
And it obviously depends where it's carried, right? Sometimes you do need that little jump start to get you there, and that's also an important part of liposuction.
Yeah. So who is a good candidate for liposuction in terms of BMI and skin laxity? So when I came out of training, I had a very rigid view of what liposuction should be. It had to be like this perfect patient, like we were just talking about, who had a very kind of small area that they needed to contour. And through my practice and working at several different practices, some of them even being very straight liposuction only locations, that has broadened immensely. So for a liposuction candidate for me, it goes all the way from one person who just needs those little love handles, they cannot get rid of them for whatever reason, their body just won't, or on the lower abdomen, or maybe their arms or their neck. See that all the time, right? All the way to a patient who they really need a tummy tuck, but the thickness of their belly wall is not going to give them the best results. And so then we have that conversation of how about we stage it 1 and 2. We do the liposuction, we thin things down because, we want you to get to your goal of A to B. And sometimes it's not just straight there. Liposuction can help get us there so that we can do the tummy tuck or a skin removal procedure. The liposuction can help. So it's really broadened quite a bit. What do you think?
Absolutely, and I agree. And then patients also push you, right? You see this patient that maybe you thought it's not gonna benefit from it, but they're like, no, I understand, and I'm gonna do it, and then you get really good results. So I do agree that also with technology has evolved so much that technology has allowed us to maybe make a not so great candidate into a good candidate for liposuction. So I think having like realistic goals of what your expectations are and what the procedure where the procedure can take you, it's the most important thing.
Yeah, and then I think that brings you to, I mean, I'm sure you also have that conversation with patients where what is your lifestyle like? Like, what are you looking for? What are your goals? That A to B, is the liposuction option going to allow you to still do the things in your life that you kind of really need to do right now? And a tummy tuck's not going to be in the picture for you for maybe a couple of years. So then you're a candidate for liposuction. Um, when we talk about minimal skin laxity, for some patients, it's an important thing to be able to have very tight skin afterwards. And for others, you know what? It's actually not. And that's a conversation I'm sure that you also have with patients. And that's important in the consultation and meeting with us and seeing where you are. So we can understand, hey, I kind of, through my experience, through Dr. Atencio's experience, I think that you will be able to get, most likely, to this area or that area. Are you looking to wear a two-piece swimsuit, or is it more about shaping and just really feeling better about when you're wearing jeans and you don't have the fold over, or being able to wear that dress that you haven't been able to wear for a long time and you don't mind just a little bit of skin? So there's a lot that goes into who the ideal candidate is. And I think meeting with someone, a board certified plastic surgeon who's done a lot of cases, can really help give you the idea of where you fit into all of this.
I agree. I think that lifestyle situations too, like maybe a person has time to heal for a tummy tuck. Some people don't. They can't take the time. They don't have the help that it needs, maybe. So maybe it's a solution to have the liposuction, even though it's not going to have that super smooth, super tight, super defined skin, and that's okay. Everybody has different goals, and I think that's what's important. All right, let's talk about some types of liposuction. I think this is very confusing for people.
Oh my gosh.
There's so many names. There's so many machines. There's so many different marketing words that people use out there that are just meant to confuse people.
And sell, I mean, in a way.
That's absolutely. Is, right? I think obviously technology is important. There has been some benefits that come out of using a certain type of liposuction machine or technique. However, I think that in the right hands, if you have a good plastic surgeon, the machine is not as important as the plan and the person that's doing it. Yes, there are benefits to using different machines. In my case, I use Vaser liposuction, which is ultrasound assisted liposuction. And it's really good because it breaks down the fat, emulsifies the fat. It has less trauma to the tissues. But sometimes I still use the smart lipo machine because I like the laser portion of it and try to combine it with the Vaser technology, just trying to get the most out of the technologies that I use. In some areas, I do straight liposuction in specific patients because I feel like sometimes the heat may cause some scarring. Sometimes the laser is not the best option. So it's good to have different options, but know that ultimately is the experience of the surgeon, is the hands of the surgeon, what the outcome is going to be.
What I like about what you have to offer with the Vaser is that, with my experience, because we use that a lot in residency, is that the Vaser is really great for like the back bra rolls or in areas where you have a lot of fibrous tissues. So if you happen to be that person that has cool sculpting and it just didn't get you to that goal that you wanted to be, I actually think that Vaser would be really helpful in that situation.
Yeah.
Yes.
Yeah, secondary cases, backs, men.
And yes, definitely.
Definitely a clear benefit of Vaser liposuction. If you're 20, your skin is perfect, and you just have a little bit of fat. I think any and all will do perfect.
Yes. And it's very important, I think, particularly for that one, to go with a surgeon that has a lot of experience in that, because one of the things that we think about with Vaser is that there is a heating component that the surgeon has to really pay attention to make sure that the skin doesn't get damaged. And
yes, you can
so,
have skin burns
right.
from other places.
Yeah.
So it's very important to have someone that knows how to use the technology, how to safely use the technology, because it is very, very important.
Mhm. And in my practice, I mainly use the laser assisted. I think that's very beneficial for almost all patients, where the most important thing is that it's creating a coagulation of the fat as well as helping to tighten the skin. And through the coagulation and emulsification of the fat, it allows for a little bit of collagen production. So on the right patient, I can really honestly tell them I think that the skin is going to be helped in this situation. And then I'll also be very honest with you if the laser is not going to get you to that location. If you have skin that's very stretched out and hanging, the laser is not going to tighten all that skin up. And then we have just a different conversation about expectations and such. But that's what I use in my practice. I really enjoy it. I combine it with the power assisted liposuction piece. I think you use that too,
Same.
right? Almost all
Plastic surgeons
do that. And originally, and in the literature, it talks about how it's more efficient and it gets you through faster. But my experience with it is that it helps decrease the lumps and bumps.
Yeah.
When I'm doing it, and then when I'm in a fibrous area, it really helps to get through that tissue. So I definitely get the best results using that, and I've always used that in my practice. How about you?
Yeah, I agree. I think power assisted is universally liked.
Mm-hmm.
I think most plastic surgeons, even if we use Vaser, because I use that in combination with my Vaser, and some of these technologies also help us. So the power assisted helps us like not sweat as much, I think. But I think most plastic surgeons do use the power assisted liposuction, which is the vibration machine, and you can use that in combination with the others. One is not absolute.
Yeah, so for example, so if you come in for a consultation and then that's not something that's used, it might be for you. For example, I would not use that on someone, a very small person who has just a little teeny tiny fat, because you know that we get patients like that. And if I use the power assisted, it's going to be a little too aggressive. And so if you come in for a consultation and I'm not recommending that, it's because of that reason, because what we're really, the most important thing is not to injure the skin. We want it to be very beautiful afterwards.
Absolutely. All right. And then some general info about the procedure itself. Which areas can we lipo? We can lipo pretty much anything. I think there's more common areas. Most of the time, people want to do their trunk, right? So their belly, their waist,
360,
their love handles, their back, their bra rolls. But even other areas sometimes, like thighs, arms, submental, calves, knees.
Yeah, the knees. I love the knees.
Yeah.
On the right person, just that little tiny pocket there can make a huge difference on your silhouette.
Oh, the buffalo hump.
Yep.
I have a picture about it because it's a rare thing that we can lipo that.
Arms. Those back bra rolls for sure.
The side roll.
Yeah. Yeah, and the front bra roll, especially
Yes.
even if you're doing breast augmentation.
Breast augmentation, yeah, we often just lipo this little axillary pocket, just to make everything absolutely perfect.
And one thing about the areas too that I found is if you are doing that 360 in this region, oftentimes that will actually accentuate the buttock area. So if that's something you're looking for and you already have a good shape, it might just be liposuction that will enhance that. Now we do, all of us also pair that with fat transfer. It doesn't have to be something large. It can just be for the hip dips or just a little bit of shape to get you that really beautiful contour in the swimsuit. We're definitely can add that for you.
How many areas can we do at a time? We can do as many as your lidocaine requirement lets us. So in order for us to treat the areas, we have to numb it, and there's a specific amount of numbing medication that someone can have in a 24-hour period. So we have to make some calculations based on those numbers to avoid lidocaine toxicity and do it in a safe way.
And that's all based on your weight. And also for me, it's based on how much skin you have too. So part of the liposuction component is that if you have a lot of skin, we need to put a little bit more of that fluid in to get a little back pressure to get the fat out and to do the procedure correctly. I think that if you come in for a consultation, we evaluate all those things. And for me, every once in a while, I will split up 2 areas. And what I do is treat you for a section of areas. You come back the next week, we do a post-op. Also eval of the first and then do the second portion the next time. And, part of that is because I think that both of us do, for the most part, the smart lipo, which means that you are in kind of a zone, but you are definitely with us so that you can move around and we can get the best result for you because we can get into those little places that are difficult to get. But it's just the best way. Yeah.
Yes, I think we all do. We can separate them, and we in a consultation, depending on how many areas you want, we will tell you, okay, we can do these many at this time. Sometimes it's all of them. It depends on how much fat. Obviously, if there's not a lot of fat and tight skin, a little bit of fluid goes a long way. If you are a little bit taller and wider, then we need more fluid. So it's based on those dimensions and how much fat we're trying to get, that we can either do multiple areas at once, all at once, or just some areas at once.
Yeah, and I like high concentration within safe limits, just so that you feel good, you tolerate everything well, you're feeling well when you leave.
Absolutely. I snoozed all my patients.
You what?
Snooze them.
You snooze them?
Yeah, they're pretty comfortable. For sure, yeah. And then we use a lot of that lidocaine to get the numbing, right? To get numb so that it's not super uncomfortable.
Yeah, it's so funny because I used to snooze them, and now I don't feel like I snooze as much, but I usually try to stay on the higher concentration per bag. And we've done really well.
Yeah. Most people do well.
Yes, I would say like 98% of people are usually very, if someone comes in concerned, it's really funny. They're surprised. They're like, oh, that was it?
Yeah.
Oh, okay.
Yeah. It's like, are you done?
No. Yeah.
All right. We talked a little bit about the anesthesia. We have sedation. We also have Pronox, which is nitrous oxide gas. It's like laughing gas, like they use at the dentist. That can be used in combination with medications to get you more relaxed, and you can use it as much as you need to throughout the procedure. So that's also nice to have if you're nervous.
I don't use that.
You don't?
I don't.
Oh, it's fun.
I don't.
Yes, people love it.
I don't. Yeah.
Yeah, you should try it. All right. Scars. Let's talk about scars.
Yeah. So I think the biggest thing with scarring depends upon where you put they call it added sites or the incision sites, which are very small, very small. And it depends on the area that you're treating and kind of the curvature of your body, because what we're using are these things called long cannulas, and they don't necessarily curve. And so we have to keep that in mind whenever we're treating. But the scars, they heal really well. Obviously, if you historically have a scarring issue, then that's something to talk about. And we do have lasers and things that can help with that process as you go through the healing. I do like to put a stitch in
me too.
In mine, and I think that they heal so much better. And then we put a little Aquaform Band-Aid, and just obviously walk you through the process as you're healing. But I don't think they're bad at all.
Yeah, we hide them in places that are hard to see or are natural skin folds.
Yeah.
They're about 4 millimeters in length. And I do as well put a stitch. I don't put it in the center. I put it in the corner. So that there's a corner that still drains, but the stitch kind of everts the edges, and that's what I like. But that's total, But I don't think that matters either. Some people don't ever close them. Some people close them, and it's one of those things that, as plastic surgeons, we have certain preferences, and the important thing is that you get good results and that your scars look good.
Yes.
How long it takes, it depends on the amount of areas. It could go anywhere from like 30 minutes to an hour if it's just here, for example, or a couple of hours in a day if it is more areas. You will definitely need a ride home because you'll be under medications, under the effect of medications, feeling like you had one too many glass of wine. So it's important to have someone to pick you up and drive you home.
Yeah. And I always stress that you absolutely, I mean, ideally someone to bring you because we will have had you take some medicines. And then to drive you home and then be with you for 24 hours because not that we're expecting anything, but you might get a little lightheaded. You might just need to be thinking about what your medications are. And I want someone there to make sure that you're drinking fluids, getting up to go to the bathroom, eating, but not eating something that's going to make you feel kind of nauseated. So that first 24 hours is just important to have someone there for you. And we'll talk about that with you at the pre-op appointment.
It's good that you bring that up because for me is hydration.
Mm-hmm.
I feel that after liposuction, you need to stay hydrated. And if you're in pain and you're uncomfortable and you're in the sofa, you're like, oh, the Gatorade is all the way over there.
Yes.
And you can have someone there to help you just stay hydrated because it's very important. Otherwise, you start feeling dizzy when you get up to go to the bathroom because your body's going through all of these changes all at once. So having someone to be there with you, even just to pass you the Gatorade is important and it's helpful.
Yes, exactly. Great. Let's see. So expectations, just activity restrictions. So with all plastic surgery, we kind of think of this 6 weeks window of recovery. With liposuction, it's a little less than that. In terms of being able to do activities that you were doing before. So in my practice, I like patients to really kind of take that first week off of doing exercise and such. You can go back to work when you feel ready and you're not on pain medications. Oftentimes it could be just a couple days. You will be encumbered by having the compression garments or the binder or the things that we've recommended to help you get the results that we want you to have. But other than that, you can start doing some exercise within that 10-day period for me. Before that, I think that might increase your bruising. And I just tell you, and I tell everyone to, once you go home and I've done my procedure, you're really looking at yourself in the mirror. You're feeling how much swelling you're having. You kind of become the doctor in that way. And if you do something and all of a sudden you feel really swollen, you say, okay, I got to back off just a little bit. If I went for a walk around the block, maybe I shouldn't do that. And maybe I should just go up and down the street and then kind of increase from there. And then depending upon the area that you've treated, then we have a discussion about, what kind of exercise will not irritate that area. And then from there, probably around 3 weeks or so, we've evaluated your incisions and everything looks good. Then you can think about getting into water if it's the summer, right? And starting to get increasing in your activity. So I think that the restrictions for the surgery are definitely a lot less than any of the procedures that we do.
Absolutely.
Patients really are just back doing what they were doing to begin with, and that's the draw. I mean, I think liposuction is, when you take into account everyone, I was reading something recently, everyone who does it in the world, it is far surpassed even breast augmentation.
Oh yeah. I mean, but I don't know about you, but I pretty much do liposuction with all of my other cases. I do liposuction with my tummy tucks. I do liposuction with my breasts.
Yeah.
So there's always an area to do a little bit of lipo. So I can see how it's definitely the most common thing that we do because we also combine it with all these other things that we do.
Yeah, and because we're doing the smart lipo now, where patients don't have to go under general anesthesia, they feel so much better afterwards and can get right back to work and their normal activities. That's a huge plus.
Let's see. Activity restrictions for me about the same. I think in terms of, you're not going to really ruin anything after surgery from like going to work out. However, you will swell. You're in a period of inflammatory reaction of your body is creating all of this fluid and it's getting swollen because it's trying to heal the area. So if you work out too soon, then you'll swell too much and then it will take longer for you to see the results. It's not going to really ruin much, but it's going to make the area more swollen. Maybe we have to get like more foam in certain areas that are now swollen, maybe. So definitely at least 10 days. I always say 2 weeks, at least 2 weeks of taking it easy. You can walk, you can go up and down the stairs, you can go to the pharmacy, you can go to the supermarket, but nothing strenuous, nothing excessive. And after that, you can see your body will tell you if you're doing too much, you're gonna swell too much, or you're gonna hurt too much, and then slowly increase your regular activity level.
Mm-hmm. Yep. Okay, expectations.
I think we touched base about that, and some adjuncts to liposuction. So I think that skin tightening procedures, the laser comes into play, but then other things like oil therapy or microneedling or like radio frequency, exactly. Definitely things that people sometimes pair with liposuction, especially if you have a little bit of skin laxity and you decided to do the liposuction because you cannot do the tummy tuck and you have a little bit of wrinkly skin, those alternatives that treat the surface, area of the skin can help you also get a little bit better smoothness of the skin through non-invasive treatments.
And we do offer all those things at Westlake Dermatology. So that's something we can have a conversation with about as you are in the healing process. Because I kind of feel that I really get a sense of the skin and what it's doing by about, at a minimum, a month and a half, kind of feeling it out. And then we can start planning on kind of what we should do with that. And one other thing that I do, and I don't know if you offer this, but at one place I worked at, and so I brought to Westlake, it's called the alveolar tummy tuck. Have you heard of that? Yeah. So it's doing the procedure of taking off, if you're that perfect candidate that just has that little excess skin or a little bit of fold over, we do the liposuction in the lower abdomen or the whole abdomen 360, and then skin only.
Yeah.
Yeah, under tumescent, no drains.
Yeah.
Yeah. And so it's not this, if your main goal or concern is that, wow, your muscles are so stretched out from a few kiddos, well, that's not really going to do it. But if you have a little excess skin at the bottom, a little fold over, and it's going to make you feel better having that part taken off, that can absolutely be done.
Yeah.
At the end of the surgery. Easy. And it's pretty easy. You do get the scar.
Yeah.
Take the scar, but the recovery is night and day from a tummy tuck, and I don't really think about it as like a tummy tuck.
Yeah, exactly. Me either.
Mm-hmm. Yeah. Some people call it maybe skin only in their version.
Yes. Right? Yeah, that's what I call it.
Yeah. Okay. Yeah. Yeah.
Perfect. Other things, fat transfer, we touched base a little bit. Fat transfer to buttocks is very commonly done, but we transfer fat everywhere. I like to say this because we can transfer fat to the face, we can transfer fat to the lips, we can transfer fat to the hands, the breast, the buttocks, as everybody knows, the hip tips.
Yeah, I think that's the best part, and I think that Westlake Dermatology is the king at being able to do that and just really getting some beautiful results, which I think you can see online. And we have just beautiful patients where we tailor that center portion and then just put a little bit to get that beautiful contour. It's lovely.
So it's fun if you're doing the liposuction part, which already is the hard part.
Yeah.
Then you can just reuse the fat and put it in places where you need a little bit extra. And like you said, you don't need to have a ton because you don't necessarily need to have like a big anything. And just a little bit of fat put in the right places can make a big difference. So I think that that's also fun to do and to add and easy to add to your procedure.
Yeah. And we've been talking about small fat transfer. I mean, we're talking about liposuction. You can do big transfer. So I did my aesthetics fellowship in Miami with Dr. Miami, and we would do 4 a day of the BBLs, so liposuctioning everywhere and taking all of that fat and trying to make the buttock as large as possible because that's what they wanted, I mean, that's just
to each their own.
To each their own.
That is the beauty of plastic surgery.
Right.
If you have a lot and you want a lot, then that's perfect.
Yes, exactly.
And then another thing I like are lymphatic massages. If you've met me and come for a consultation, I'm all about it. Lymphatic massages help with bruising, help with swelling. They help drain all of that fluid, all that inflammation that happens after surgery. Sometimes can help with fibrosis, can help with some contour deformities or like just skin that sometimes wants to heal a little bit harder. They try to soften all those scar tissue that forms with liposuction. So I love lymphatic massages.
Yes. So in one of the other practices before I came here, we didn't really push it that much. But now that I've been with Westlake for a while now, we offer that to patients. We have a great place that we recommend where they go. And all the feedback, honestly, I get is this has helped me. This has made me feel better. And patients are immediately that 2-week period. They have scheduled their times, and I've never gotten negative feedback about that, only positive.
Absolutely. Everybody feels better after they're gone. I have different places that my patients have used and have liked, because not everyone lives around a certain area. So we do have multiple options that you can pick from. Or if you have, one that that is good, as long as you're noticing a change when you go to the lymphatic massage, you have to feel that it's working. That's what my patients say. I felt so much different when I came out of it. So as long as that's happening, then you're having good results from a lymphatic massage. And I like to do them as soon as post-op day 1.
You do?
Yes.
Okay.
How about you?
Okay. I mean, I usually say at 2 weeks just because some patients have just that tenderness. I don't want them to go there and have a bad experience with it per se.
I know. They never go on post-op day 1, but they go on post-op day 2, which is okay because you are tender and it's hard to have someone touch it. But the reality is the massage is not hard. You're not going there for a Swedish massage. It's actually very soft. It's just draining the fluid. So I like them as soon as possible, but obviously everybody's schedule is different, and people have done them a week later or 2 weeks later. But I think they're helpful across the board.
Yeah, and I think that if you're going to choose someone who maybe is not on our list of recommended providers, just making sure that they work with surgery patients, I think is useful because there's kind of a big difference.
There is. Not every massage is lymphatic massage. And there's definitely people that specialize on massages post liposuction or post like tummy tuck or like plastic surgery procedures. That is very important.
Exactly. I think it's important to mention the timeline with lipos. It's not. There are some areas where you treat them and I'm like, wow, 1 month, I can totally see that difference. I love your before and after pictures. They love their before and after pictures, and we're all excited, right? And so those areas I find are in the flank area because that skin is nice and tight and you can already see where that waist is pulling in, and in the neck typically. But for some of the other areas, and depending upon the patient, there is some swelling, and the swelling kind of stays for a while. And the way I describe it is that you have swelling goes down, and then it's a slow, gradual 3 months, 6 months. So you still have something there to trim down up until the 6-month period. So if you're planning on getting married and you need to get your dress fitted, and I have had this happen once, and you have liposuction, but then you need your dress fitted in 2 months, that is not going to work. I just do. So I have that conversation now, like, hey, what's going on in your life? Do you have something really important in 2 months from now that you need to fit into? Well, we need to think about it,
Yeah.
So
I agree. I think that you get a glimpse of what you're gonna look like on day 1. Sort of an idea of what it's gonna be. And then at 6 weeks you already look good. Certain areas look really, really good.
Yeah.
And most people get excited.
Yeah.
And oh my God, this looks great. And I'm like, you just wait. It keeps getting better at 3 months, and by 6 months, you'll still get better. Because there's this inflammatory process. And I do tell patients that sometimes, especially in women, with our cycle, you have more of a roller coaster of swelling. And all of a sudden you think that you're done with your swelling, and then the week after you kind of bump and you feel poofy again. And that happens for the first 6 months after the liposuction. So I agree. I think full 6 months to see your final results.
And then I think what you just mentioned touches on, well, then how long am I supposed to wear that garment? Well, it depends on what your swelling is doing. It depends on what your tolerance of how it feels on you. I mean, I personally, if I was having it done, I would wear it as long as possible, especially when I was working out or going to be doing something where I was going to have some swelling, because I really want that skin to retract and to get the best results. I just want to do it once. But that just kind of depends on how you are feeling in it. And there's different things to get around that. So I have some patients that are like, oh my gosh, this thing is driving me crazy. It's itchy. So then the next thing I say is, well, okay, let's think about other kinds of compression or garments that might fit you better. And we have a lot of recommendations for them. You'd be surprised how much stuff is on Amazon, because there have been a zillion things created for liposuction. And then there's other little tricks, like putting your a camisole on as things have healed a little bit. Put a camisole on and then put the compression over it so it's not directly on your skin. So garments, it's different for everyone. There's a lot of different information out there, and definitely it gets tailored to you, and you will learn what you like and what you don't like.
Yeah, I think garments are the second most important part of liposuction, and the people that wear it the most and wear it the longest get the best results.
Absolutely.
And that's it.
Yep.
So I do agree that sometimes it is bothersome, and what I tell patients is like, don't let it get to a point where you cannot wear it anymore.
Yes.
Instead of that, you just take a day off.
Yep.
Take 2 days off. Take a weekend off. And then you start again then the week after, and you wear it as much as possible for as long as possible. Yeah. Because tissue gets remodeled through time, and it's not only the swelling, but you're gonna reshape yourself, reshape your skin the longer that you wear it. And you will have to change it, because the first garment that you purchase that fits you is not going to be the same one that's going to fit you a month later. It may be a third one, because you're going to be reducing in size, which is the reason you got liposuction in the first place. So you keep tying it up.
Yeah. I would agree with that. And it doesn't have to be the really hardcore garments either. I mean, we kind of do that in the beginning, but then especially with legs. I mean, I say you can go on to some of these tight
Spans.
Yeah,
sometimes
Lululemon type are really tight, and they
a size smaller.
Yeah, a size smaller, and that will kind of do the trick too, and it's much.
Yeah, so there's alternatives, obviously, and some areas benefit more than others. But the longer that you wear something compressive, the better your results are going to be.
One that I think does have to have some forethought, though, is if you get your chin done, right?
Yeah.
I require the 24 hours, basically, unless you're showering, around your face. And so kind of you have to be stuck with that. And then after that, it's only 12 hours a day. But really, the longer you wear it, the more of that nice curvature, which is what you're there for, you'll get. And so that one's a little more in your face and you can't cover up. So that's something you kind of want to think about. You want a big presentation. Scheduled 3 days later.
Yes. And sometimes what I tell my patients that are getting their neck done is just own it.
Yeah.
Right?
Yeah, true.
Just own it. Just wear your garment. Tell people, obviously, if you're in a client presentation, maybe not then.
Yeah.
But otherwise, just own it. Just wear it. It's a little bit of lipo. Everybody has a little bit of fat there. And but I do think it's very important, especially if you have a little bit of skin laxity there. If you wear that garment, that skin's gonna stick back up. But if you don't, that skin's gonna relax too much. So you need to train that skin to stick up there, which is against gravity, right? So that's why the neck garment is so important, because it's against gravity. Every time that you're standing, that skin is pulling down. So the more that you wear that garment, the sharper that jawline is going to be.
Plus, I think it helps to eliminate or decrease the risk of having little puckering, little bumps, because those are really hard to fix, because that skin in that area is very thin.
Yeah.
And so it helps redrape that area. And one other thing I've learned in time, because times have changed. So you have liposuction in the neck, and one huge thing I tell patients is, guess what? When you go home and you're sitting around the couch, guess what are you going to do? You're going to get on your phone and you're going to do this. No. You will get some little thing in there because the skin will want to attach.
Yeah.
Pump up the pillows and do this.
Yes.
And it's super important so that you're up and kind of curved. Yep.
Yeah,
sure.
Absolutely. Very, very important.
Little things like that.
Well, it hurts. I think that everybody has different pain tolerance. I think that liposuction in general is not a very painful procedure. Most patients need pain medication 2 to 3 days. After that, they can. I give my patients ibuprofen. Do you?
No,
Yeah.
I don't.
Yeah. So after that, I let them have ibuprofen and Tylenol, and I think most people get off of the narcotic pain medication. But some of my patients only take Tylenol and then just maybe take pain medication at the end of the day. Because if you
Yes.
start moving, then
Sleeping.
you're gonna be sore at the end of the
Mhm.
day. You might need something, but it's not particularly painful.
Yeah, I would agree with that. Everyone has different sensations. Some people, they're feeling a little bit of a burning sensation. And some, I'd say, well, that's like 10%. A big portion of patients feel like they had a really big workout. Other section of patients have itching, which is really interesting. They have tickling. Those patients, I think, also have tickling when we're doing the procedure. And sometimes those are even harder to do because they want to move around a lot.
Yes.
But that's always a fascinating one, is when it's
And some people like try not to laugh.
yeah.
And then they do these noises, and I'm like, "Are you in pain?"
Right. Mm-hmm.
And then I start worrying that they're in pain, but they're like, "No, it's ticklish," and I don't know how. I'm like, "Just laugh. It's fine.
Mm-hmm.
It's better than being in
Yes.
pain."
For sure. Yeah.
All right, so let's go over some of the questions that we have here in our chat. We kind of answered that one. Can you get pregnant after having lipo, and will it change the results?
Well, yes, you can. I mean, if you're within the range and you can have children, will it change the results? Most women that I've met, there's very few out there that don't gain weight when they're pregnant. I mean, you're supposed to gain a certain amount. The range that they recommend is about 25 pounds. I do not think that's the average. So if you're gaining more than that, what is happening? You are stretching out the skin. Your fat cells that are still remaining are getting larger. Then all of that depends, like your result after you have the baby depends on where your pregnancy journey has taken you. So yes, you can gain weight and the results can change for sure. And even just with pregnancy in general, I mean, that is a full body experience and a bunch of things are happening. And there's no way to tell what's going to happen to you because things are very different for most women, but your body will change and you just, see where it goes. And we're here to have that conversation. I usually like to wait until after a year that you've had your kiddo because there's a lot of fluid fluctuations and a lot of not sleeping and such. But yeah,
I agree. I think pregnancy changes women's bodies, and it's gonna change yours. After pregnancy, some people go back and look the same as they did before. So it could happen that that's your case, but it could happen that you store a little bit of extra fat and then you end up needing a little bit more liposuction. I think it's hard to predict the outcome after pregnancy, but just be happy, have your babies, and then we'll figure it out.
Yeah, and take care of yourself. I mean, I think sometimes in our culture, we're like, go ahead, you're pregnant. But really, if you try not, if you have a healthy lifestyle, you still try to exercise,
yes,
eat the way that is healthy for you and the baby. Of course, you can have some cravings and things like that. But that healthy lifestyle does help you regain back to where you were.
Multiple reasons, right?
Mm-hmm.
If you maintain a good nutrition, good exercise habit, you don't gain too much weight during your pregnancy, you may be that you could get away with liposuction instead of if you gain a lot of weight and then lose it, then there's a lot of skin and then you end up like bumping yourself into now I need a tummy tuck. So obviously having good lifestyle, maintaining your weight as healthy as possible is always going to help in the long run for liposuction or any other plastic surgery procedure. Breast, everything changes with weight. So it's always important to maintain that healthy lifestyle.
Now, I have to put out there that from a personal level that even though I say that and that's like the perfect thing to do, I definitely didn't do that.
Yeah.
I have 4 kids, and I think that the one that the least amount of weight I gained was 36 pounds, but I've gone up to like 182. Yeah. And my average is like, yeah, I know she's looking at me like, oh my God, wow. And it's just, my body just wants to, just keep it on,
You see?
Yeah.
And baffled.
Right. And it takes me a good year and a half to kind of lose it. And people are like, oh, you're, so how did you do that? You've had 4 kids. And I'm like, no, there's changes really, and there's things that if I wanted to fix, I need to fix. But So even though we're saying do all those things, it's hard.
It's
to do,
hard.
and I understand that.
Do you lose weight with liposuction? Yes, I think you do. Well, it depends,
Yeah.
right? If you do lipo here, you're not going to lose weight. If you do lipo of your arms, you're not going to lose weight. And the amount of fat is also significant. But I do think that if we do like 5 liters of liposuction, maximum amount of liposuction, people do lose significant amount of pounds.
Yeah,
But I don't like people focusing on that because
Yeah.
that's not the focus of liposuction.
yes.
If you see a change in your scale, nice. But that doesn't matter. Because even if you're the same weight that you were before liposuction, you will look better and smaller and better contoured. So it's one of those things like breast cup size, I don't care for. I also don't care what the scale says, as long as you look good, you feel good, right?
Mm-hmm. Yeah, I definitely push it as it is not a weight loss procedure. I think that a lot of the weight that, or some of the weight that we carry that we're concerned about is actually ingrained in the muscles and some other areas and are also intra-abdominal. I would say that the most important thing is that it's contours, contours, how you're going to fit into your clothes, how you are going to feel because you look closer to where you want to be. So then your lifestyle changes naturally and you exercise more, and things just change in your life. But it's not in my opinion, a weight loss procedure.
Definitely not.
Yeah.
Yeah. And that's why you can or maybe not see a change in your weight.
And you won't see it at first because you sweat.
Oh, for
right?
sure.
So
Yeah.
that's one thing. Yeah.
And it has to be accompanied of healthy lifestyle too, because if you after liposuction then now start eating more because now you look better, then you also may gain weight.
Mm-hmm. Yeah, because that's the important thing, I think, is that those cells are still there. So we take out a bunch of cells and that's awesome, but you still have cells in that area. Otherwise, if we take all of them, your skin gets really like kind of rippled and we don't want that, and that's where experience goes into play. But if you bring in calories, those individual fat cells can still swell. And so it's important that it's just not a one and done. You do your procedure, you go through the recovery process, and then you continue to go on. Exercise, diet within reason, doesn't have to be crazy, but something that allows you to maintain the results.
Yes, each fat cell can always get bigger.
Yes.
That's why people can get to be 700 pounds. Is because those fat cells can always get bigger. So you can always gain your weight back and lose your results if you're not careful with your diet and with your exercise and maintaining the weight that you were at the time that you were getting liposuction.
Mm-hmm. Yeah.
How many massages will I need after lipo?
I see people do a lot of them, and they just because they love it so much. So, I mean, sometimes it's twice a week, and they'll do that for several weeks. But obviously it costs money, so it depends on, and also it takes time off of work. So it's just up to you. But I would say probably for a 3-week period, if you could, I think that will really help.
Yeah, I think the first few weeks are the most important. Yeah. I think having at least one is beneficial.
Mm-hmm.
It's one of those things that maybe you don't have the money or the schedule, the time in your schedule to do them multiple times for long periods of time. At least get one. Yeah. It will help. Mm-hmm. Obviously, the more that you do, the better it is. I also tell patients that I don't know exactly how many you're going to need because your swelling is very particular per patient. Yes. What I do know is that it's going to come a point where you go to the massage and you're going to be like, I don't feel anything different. Yeah. And that's when you know you don't need them anymore.
Yeah. I would agree. Yeah. Can you have lipo, or what were you going to? Smart lipo and regular lipo and air sculpting.
I think we went over the different technologies. Can you have lipo more than one time? Yeah.
Yes. So one place I used to see that all the time, was when I was doing my fellowship in Miami, and that the patients that we would get, they wanted to augment their buttocks, and so what the gals would do is, because we had all of them at work too, have lipo, bring that waist in, put it in your buttocks, gain weight again, because you do gain it in certain areas, right? Because the calories have to go somewhere. Lipo again and do that. So that's one example where patients want to do it again and again. Or just you get it done when you're 20s and then later on
life change.
Yeah, life changes. You have
Yeah.
kids, hormones, et cetera, et cetera. And then you just need a little contour here and there because you actually start to deposit fat in specific areas based on age and
Hormones and everything that happens.
Yes. And you can work out so much and those little areas just won't. And that's where the contouring comes into play. So yeah, those areas can be done. It's a little bit harder to get those areas out if you've had them treated before sometimes, if you're a person that has a tendency to get kind of fibrotic afterward. But then I think the longer you've been from your original procedure, it's softer and it can come out. But that is one thing that comes into play when we talk about it.
Yeah, I think secondary liposuction is harder. You can bruise more, you can swell more, it can take longer for you to see your final results because of all of those. Your tissue has been through trauma before, and now we're re-traumatizing those tissues. The longer the period of time between time 1 and time 2, the better it is for all of those things. And I do think that technology plays a role. If what type of liposuction, how aggressive was that liposuction, where did you have it done? Some types of liposuction can create more scar tissue. So it's just a conversation that will also let you know at the time when we examine and feel those tissues and see.
It's very tactile.
Yes.
Yes.
Does my BMI need to be something specific for lipo?
I think that depends on what your expectations are and your health and your age. And I've done BMI. I mean, I really try to keep it no more than 35 personally, because then that's kind of a whole other conversation. But there can be, depending upon where you hold your weight, and if your health status is good and you're just determined to be an appropriate candidate, it can be larger. Yeah.
Yeah, I agree. I think BMI is a guideline, but it's not an absolute. So BMI is something that helps us kind of determine who's a healthy candidate, what's a safe procedure. However, I've seen patients that, for example, carry their weight in their thighs, and their BMI is really not going to come down, and they have very skinny waist, and it's just thighs. And it's like one of those things that maybe you are in the higher BMI, but you would definitely benefit from liposuction. So it's also one of those things that are not absolutes, and it depends on each case. But as a general rule, I think less than 35 for most people.
Yeah. Mm-hmm. Oh, this is.
Can I do lipo if I'm on Ozempic?
Yeah. So I'm actually at Westlake Dermatology. We started the Skinny Shop, which is awesome. It's a really wonderful adjunct, I think, for plastic surgeons, because frequently we'll have patients come in and that thickness that they have between their skin and their fat, either for the tummy or such, even like a thigh lift or an arm lift, it's just a little bit too much. And so Ozempic or the semaglutides and such can reduce the thickness preoperatively. And you come in, we have that consultation, we start you on the medication, and then are seeing you every month kind of with this plan on when we can then think is the best time for you to go forward with a skin removal, because some patients are going to need that, or we've already identified that you need skin removal surgery, but the thickness is too much there, and I want you to get to the best results and the results that you want. And this is almost, I feel like, has been such a blessing to us and to patients, where we can reduce that thickness in a way that then we can do the surgery and get a beautiful contouring result for you.
Absolutely. I think, first of all, everyone is on Ozempic. So yes, you can have liposuction while all on these kind of medications, and it can be an adjunct. I also think it's important to understand that even though you are on these medications, some pockets of fat don't respond to the medication. So you might lose weight, you might be smaller, but you might still have stubborn fat in certain areas that just don't get better. And that's where liposuction shines, right? That's where we absolutely are sure that there's only one thing that can help with that area. But yes, you can be on Ozempic and you can have the procedure. We definitely need to talk about your goals in terms of your weight. Where are you on your weight loss journey and what that's going to look like in the future, right? But definitely there's no contraindication.
We do have you stop the Ozempic or other weight loss medication like that ahead of time, just to make sure that you're in a good position to have surgery and still not having the gastric emptying issues. And again, that's just making sure you're in the healthy, best position to have surgery, and then waiting a few weeks afterwards because you're on pain medication, et cetera, et cetera. So there is a little stop and start that does happen though.
Perfect. And yes, the last question is, can you do liposuction on men? And absolutely, we can do it, and we'll do it all the time. And what if I'm close to 80? If you're close to 80, let's just talk about this. How is your skin? Yes, you can have liposuction at any age, like we said before, with the appropriate expectations. And the evaluation of the skin. Not everyone's skin is the same. Some people the same age have different skin laxity. So age is not the only thing that we take into consideration, but it is going to be important to talk about which areas and what the end result is going to look like.
Because an 80-year-old can look very different from one person to another. And that's been my experience with that. So it's not a complete contraindication by any means. Yeah.
Perfect. Well, thank you for being with us tonight.
Thank you.
We appreciate all of your questions and your attention. And we hope to see you here soon.
Yeah, and we would love for you to post any questions to any of our social media accounts for topics that you would like us to cover. Dr. Atencio and I are committed to kind of bringing out information to you. And
yes, we want to make information available. That's why we like to do this in a conversational kind of way where people get to ask all the questions, things that maybe they feel embarrassed about, so that, we can help in any way we can.
Yeah, and I think we're having another discussion
next month.
Yep, and that will be on
labiaplasty.
So that is especially one
for the girls,
where patients feel, oh my gosh, I really want to go in and talk about this. So we will be talking about it, and in the comfort of your own home and the privacy of your own home, and then you can make that decision if you want to come in and chat with us. All right.
Thank you so much, and have a good night.
Yeah.